Okay.
Yeah.
Okay. Good evening, everybody. Welcome to today's edition of Ask the Doctor. So today I will be the host and also the co-host for today's program, as Dr. Fred, though is with us, but it's not um, fully available. So we'll be talking on tobacco, quit now and breathe better. So everything about tobacco, that's what we'll be talking about. When they talk about that, we talk about smoking and smoking tobacco. Now, tobacco can be on in any form. You can smoke tobacco in any form. So we'll just talk about it and see the kind of effect it can cause to us and what we supposed to. And it's also a way to educate us, to remind us, say, smoking, as they always put them for all those carton when they carry the cigarette, as they always put on smoking, it's liable for someone to die, to on life young, to on life young. So today we'll just be looking at these things about the things when we make person get problem with smoking, and then we'll try to explain them one after the other. Before we continue, I just want to remind you, say, we've been licensed medical doctor, myself, Dr. Irobono Sosa Israel, and Dr. Fred, and we know they take our license plate. We know they prescribe drug for a year. We do only try to educate everybody in the simplest language, and try to also give some instance when we make everybody understand wetin we dey talk about. It go go to say make we share this life so that other people will come join, make dem still come listen, make dem still come learn wetin you dey learn today. um If you dey watch us, and abeg tell us, put on the comment section where you dey watch us from, and just put on the comment section where you dey watch us from, and also let me know if you dey hear me clearly. So put on the comment section. And another question wey I wan find out is, wetin you know about tobacco? Why I dey talk tuberculosis? Because e dey look alike. Okay, wetin you know about smoking tobacco? And if you don smoke before, drop am for the comment section. And if you dey smoke now, you can still drop it on the comment section. And another thing wey we go know na, for those wey dey smoke, if you join this life, we go wan make you tell us why you dey smoke. What is the reason? How you even take start? You fit drop am for the comment section. Make we for know, and make we all for still learn one or two things from that. Welcome to today's edition of Ask the Doctor. So we dey wait for you. If you dey hear us, good evening. Tell us where you dey watch us from. Also, make we try share the life, make we like the life as well. This topic go dey very interesting, and e go also dey a bit short. So tobacco, quit now so that you can breathe better. When we say quit now, it means say tobacco no get any good wey dey do for us, or wey e go do for our body. So e go better say we stop to dey smoke, for those wey dey smoke, so that make we for fit breathe well. And not just for yourself alone, for people around you, because as one person dey smoke, e dey also cause problem for people wey dey around them, because you also know e dey cause air pollution, and this air pollution go fit still affect people wey dey close to you, because smoking dey cause a lot of problem. Smoking can affect from every organs of the body. Tobacco can affect every organs of the body, from the head go reach the toe. They get one problem when smoking fit cause. If you dey hear me, say make you share the life so that other persons fit join us. If you no dey share this life, e no go make sense o. And e go also good if you get questions, just dey arrange the question down. We go just drop am for the comment section. Remember, we say we no dey treat anybody for here, so no ask us question like no ask us question about which drug I go take or which medicine I go take. And also remember what we dey talk about. Today we dey talk about tobacco and about smoking. So let your questions also be within that line. And let your question also be within that line. So make I not too waste time, we will just dive into it now so that make we for the go. I believe so many persons they listen and they're ready to hear wetin we get to talk today. I said Dr. Fred dey with us, but he not go fit come up today because of because of some important other things when he get to put in place. And don't worry, when we get to know, we'll know send a congratulation message for Dr. Fred. So as we talk, we say tobacco comes in different form. People they smoke so many things, and everything when person they smoke, so most of them contain tobacco, and it comes in many forms. Now, e good make you know say tobacco get a negative effect in every part of our of the body. As I first talk, I say tobacco go fit affect every part of the body, go fit cause different problem for all the organs when they do one good work or something for our body. E fit even cause, and e go fit lead to some other conditions when e don reduce the immune system when dey our body. Our immune system na those white blood cells wey dey help us dey fight different diseases. So sometimes when not sometimes, when people dey smoke, as time goes on, that immune system go fit dey reduce, and those one na some of the things wey tobacco go fit cause. Now, apart from say e go affect our body, e go fit still affect our economy, our finances. E go fit affect our finances, and e go fit even affect how we present ourselves. That's why when you go see some persons wey dey smoke, when dem go some places, some people no go even want make dem no wan associate with them. Not because of say anything o, na because of how they look, their presentation. Now smoking can also cause, fit cause that kind thing. And another thing na im be say the odour of smoking sometimes dey follow most persons wey dey smoke, and because e dey follow dem, dey go need to spend a lot of money for body spray and all that, money wey dem for use take do some other thing. And sometimes if dem don go smoke come back and with the smell, people wey dey close to dem go wan dey shift comot from where dem dey. You can see say smoking e no dey sweet. Yes, we know say some people go dey talk say why dem come legalize smoking na? If dem legalize smoking, does it mean say e dey good for you? E no really mean say e dey good for you. So today I no come tell you say make you stop smoking, no, but I come give you information about wetin tobacco fit cause. So when you don get this information, e come good for whoever dey smoke, make e come take decision, or if e go continue to dey smoke, or if e go stop to dey smoke. I never see say anybody tell us where e for dey watch us from o. We just greet and nobody don respond to our greeting. That one no make sense reach o. Please, you respond to our greeting, good evening, and you go still tell us where you dey watch us from. And I believe say we dey share this live session as we dey continue. So tobacco fit cause a lot of problem, ranging from cancer, stroke, fit cause heart problem, fit cause lung problem. So I go list all these things as we dey go. So there are two types of smokers. We have the passive smokers and the active smokers. The active smokers, these are the people wey really dey carry this tobacco dey smoke in different forms. While the passive smoker, these one na those people wey just dey around, but dem no dey smoke, but dem dey inhale those things wey these smokers dey bring out. So because dem inhale am, dem themselves come become passive smoker. That is why I will talk say this smoking dey cause air pollution, and as e affect the health, people wey dey around go inhale those air, and e can actually affect dem. E go fit still cause cancer for dem, e go fit still cause stroke for dem, because dem dey close to people wey dey smoke. And if somebody like that come get, maybe e get asthmatic, because e dey close to people wey dey smoke, e fit worsen a asthma or dey make the person dey get attack almost all the time. So this tobacco, wetin e contain? Wetin tobacco contain? So before I tell you wetin tobacco contain, say make I remind you say today we dey discuss about tobacco. Quit now and breathe well. Also say make I remind you to share this live session. Dat na one way wey you go fit take support us. And if you never dey follow us on our different platform, e go make sense say you dey follow us. Just get information say people dey watch us from Facebook, dey watch us from YouTube. But the only little problem wey we get na be say people wey dey watch us from Facebook, we no dey see their comment. But anyhow, we go see how we go take get their questions, when we go also read their question out and answer them as we reach time to ask question. As I said, if you get any question concerning this topic, please drop am. Drop am on the comment section. Also, for those of us wey dey Facebook, if you notice say, as I said, we no dey see your comment, e go good make you move go YouTube. If you can move to YouTube, so that we go fit dey see your comment, because those wey dey YouTube, we dey see their comment. So if you dey Facebook, to help you so that we go fit see your questions, and e no go take time, maybe we come delay from reading your question, e go good make you move to YouTube. When you move to YouTube, we go fit read your comment and we go fit answer your questions. Okay, now wetin be the things wey dey tobacco? One of the things wey dey tobacco na dem dey call tar. Na dem dey call tar. TAR. Dat one contain a lot of substance. And dat one na one of the substance wey go fit lead to wetin wey go fit cause cancer. Now, smoking, tobacco na one of the high classes of carcinogenic agents. When we say high class of carcinogenic agent, e mean say e join all those agents wey e be say when we dey talk about cancer, dem be one of you go mention their name, and tobacco dey part of it. And one of the substance wey make am don dey part of it na dis tar wey e contain. So e contain a lot of hundreds of chemicals. Then another thing wey dey tobacco na carbon monoxide. And we already know say carbon monoxide dey poisonous. Remember those people, wetin be carbon monoxide? You remember, for those of us wey get generator, that smoke wey dey come out na carbon monoxide. Na make, if you lock that generator for inside house with somebody, and the generator dey on, wetin dey happen? Most of them go on live. So na the same thing. Come imagine you go come dey inhale that carbon monoxide. And another bad thing wey that carbon monoxide dey do, that carbon monoxide, if e enter the body, e dey poisonous. E go fit affect the red blood cell. E go push oxygen comot from the red blood cell, then e go take over the red blood cell. Then e go come reduce the number of oxygen wey dey circulate for the body. And that one, and you know say the human body need oxygen very well. Another thing wey dey tobacco na nicotine. Nicotine na be the substance wey dey make people dey addictive to smoking. Nicotine na be the substance wey dey tobacco wey dey make people dey addictive, wey dey make people dey continue to dey smoke. Wey be say when dem take one today, tomorrow dem wan take two, next tomorrow dem wan take three, because of nicotine. Madam Blessing, happy new month and happy Sunday. Happy new month, happy Sunday. Thank you for reminding us. So today is the first Sunday of June, and it's also the first day of June. So happy Sunday to everybody and happy new month. We thank God say we don't enter another wonderful month. So I don't mention three things now wey dey tobacco. One na tar, the other one na nicotine, the third one na carbon monoxide. Nicotine, as I said, na dey cause addictive. Na dey make people dey addictive to smoking. They make people dey continue to dey to the smoke. Now another thing wey dey tobacco na wetin we dey call benzene, another one na hydrogen cyanide. Make we just forget those names. There are so many chemicals. You just know say there are so many chemicals, but those first three when I mention, I just want make we mention them so that make we know some of these chemicals wey dey tobacco. And these chemicals are not friendly to the human body. They are not friendly to our organs. They are not friendly to our tissues, and they cause different problem for our body. So now, make we come put mouth for those effects, those things when tobacco fit cause. The things wey tobacco fit cause. One of them na e go fit cause cancers. E go fit cause cancer. As I talk, e get a lot of carcinogenic agents for tobacco. So one of the things wey e go fit cause na cancer. And one of the cancer na lung cancer. You remember say na smoke, and when you smoke, where e dey enter na the lungs. So e go fit destroy the lungs and e go fit cause lung cancer. Apart from the lung wey e go fit affect, dey cause cancer for there, e fit still cause cancer for the bladder, e fit cause cancer for the bladder, e fit cause cancer for throat, e fit cause cancer for mouth, e fit cause cancer for kidney. For women wey dey smoke, e fit cause cancer for their cervix and even the pancreas. E fit cause cancer. And when e don destroy the pancreas, you know say pancreas get im own function. And one of the function na im be say pancreas na im dey produce one hormone wey we dey call insulin, wey dey help us for wey dey help us dey mop up our sugar wey dey the body. So another problem wey smoking fit cause, e fit cause type 2 diabetes. E fit cause type 2 diabetes. Another thing na im be say e fit cause problem to our heart and our blood vessels. When we say blood vessels, we dey talk about the artery and the vein. So when we cause problem to our heart, e fit cause stroke, e fit cause heart failure, e fit cause heart attack, e fit cause all those things. Now, you remember say I say lung na be one of the major organ wey e dey affect. So when e affect the lung, e fit cause tuberculosis. E fit even cause wetin we dey call chronic obstructive pulmonary disease. Chronic obstructive pulmonary disease. So this one na long term effect of tobacco, of people wey dey take tobacco. Now when we dey talk tobacco, we dey talk about smoking of any form, because there are so many forms wey people dey fit take when dem dey take tobacco. You know those snuff when dem dey snuff, put am for nose, put am for mouth, all those things na tobacco. So in every form wey person dey take tobacco, these are some of the things wey e go fit cause. And apart from that, e fit still affect the reproductive health of human being. When we say reproductive health, na when man and woman fit take give birth to children. Now e fit cause make man John Thomas, wey we dey call phallus, make e no fit stand well again. And e fit cause infertility, e fit make sure say man and woman no born. Now for women wey dey smoke, e fit cause increase risk of miscarriage. The woman go come dey miscarriage, any small time e get belle, the pikin go comot, e get belle, the pikin go comot. Or sometimes e fit even make say when you born the pikin don already on life already before the pikin come earth. That one wey we dey call stillbirth. And sometimes e fit come make sure say the pikin wey you born, e no grow well for inside belle. Tobacco fit cause all these things. E fit even cause problem to the eyes. Wetin we dey call age related macular degeneration. E fit even cause cataract to the eyes as well. As I said, e fit cause so many problems. E fit even cause rheumatoid arthritis, e fit cause premature aging. The person go just notice say e don dey grow old even when e never old. Now when we come to the skin, when we come to the skin, some part of the body, sometimes e go cause some discoloration for some part of the body, like the nails. E fit give some kind of discoloration like a yellow brown color for the nails, for the teeth, even inside the tongue. People fit get all those colors. To the ex ten t say we don even see say some people their lips go just black because of smoking. And e go also fit cause wrinkle. The skin go come dey squeeze. You come dey even dey make people dey look say dem don old well well. These one are some of the things when smoking fit cause. um if you dey here and you dey lis ten to us, drop your comment, drop your questions, because we go ready to dey act, to dey pick your question and to dey answer your question. If you never share this life, you no dey help us o. You go make you are not doing well. So please share this life so that we go dey see, people go dey see wetin we dey talk, people go dey lis ten to am, and people also go dey learn wetin you dey learn. No come hold knowledge, no come hold dis knowledge to yourself, come make people no dey, no come make people no come dey learn things from us. So it's also good make people still learn from, learn wetin you don learn. So please drop your comment. For those of us wey dey Facebook, abeg we say move to YouTube, move to your YouTube channel, na still Dr. Fredostar name. So just search for Dr. Fredostar, move to the YouTube channel and drop your questions. We go see those questions and we go answer those questions as we see them. So no forget to follow us. Look down and say another thing when I go wan remind us. Not forget to follow us, not forget to follow Dr. Fred, not forget to follow myself as well. So we don mention so many of these things when tobacco fit cause. We don mention so many of these things when tobacco fit cause. So another thing na be say tobacco fit affect our finances. Tobacco fit affect our finances. So for those wey dey smoke, I guess cigarette. When e decide to plus, to do the calculation, even himself shock for the amount wey e take buy a pack, wey e take buy the bundle of cigarette, and e even come dey talk say dat one even cheap small, because if e dey buy one, e for spend more. Now when we look at that money in total, e himself come talk say dis money, if I put am for so, I would have solved one problem. But because e don dey so addictive to smoking, e no come fit do that. But most times dis person dey try to see say if e try to reduce the number of cigarette wey e dey take so that e go come stop. Now one thing you should know is that e no dey easy to stop when you don start to dey take tobacco. Why? Because of the nicotine wey e dey. And the nicotine dey make people dey draw people dey close, make dem dey come smoke. But this one na something wey person need to stop because of all these problems wey we don mention, and also because e go still affect your finances. Some people no go even don eat, they go wan go smoke. Another problem na be say e dey affect the immune system. When e affect the immune system, e go give road for other infection, other diseases to enter the body. Because once the immune system is affected, the immune system go come reduce, and then people fit come other disease fit enter the body. And some people fit come smoke to that extent say they no even know wetin dem dey do, and e go cause a lot of problem. Remember say I say there are so many things wey people dey smoke, and so many way wey tobacco take dey people take dey smoke tobacco, and e dey cause a lot of damage to this individual. Now no be only man dey smoke, women still dey smoke, and we don still talk say e go fit cause infertility, fit affect their womb, wey make say dem no go fit born. Even when dem even get belle, fit make say the pikin wey dem born, dey come get wetin we dey call stillbirth. Before the pikin come alive, come world, e don already go join the ancestors. So this one na things wey we say make we let you know, so that make for those wey dey smoke, you go come try to count say should I continue or should I stop? And sometimes you go say e don tey when I dey smoke, nothing don happen to me, in fact I no dey too smoke. Before when the thing go wan happen, you no go know o. And you should know say this smoking, e dey accumulate. So no be say because you start to dey smoke today, say the problem go start today, no. But e go dey accumulate gradually, and before you know, problem go start. And sometimes even this smoking fit even make some medication when we dey give not work well for person. E fit affect some of the medication when we dey give. We say e dey destroy the kidney. So when e destroy the kidney, sometimes some of dis medication wey we take, when the kidney suppose help remove from our body, the kidney no go fit remove those medication from the body, and then e go come cause a lot of problem. E go come cause a lot of problem. Now remember I say there's passive and active smokers. Now the active smoker na the one wey dey smoke am directly, while the passive smokers na those one wey dey stay close to them or wey dey perceive the smell of dis smoke. And the funny thing is that both the passive and the active dey get the same problem, the same problem. E mean say if for those the active smokers, if dey fit get lung cancer, even the passive smokers can have the lung cancer, because they too dey inhale these gases into their system. So dey go fit get lung cancer. In fact, almost all the problem wey pipu wey the active smoker dey get, even the passive smoker can actually get dis problem. Even the passive smoker can actually, na im make we dey call them passive smoker. So if you no dey smoke but you get pipu wey dey smoke around you, we go advise you to waka comot from dat environment. Make you take your two leg run by yourself comot from dat environment. Comot from dat environment, so dat make you for save life. Now for those pipu wey dey smoke and dem dey say I want to stop smoking, I no wan smoke again, wetin I go fit do? Dat one na another question. Now before we go answer the question of for those pipu, I say make I remind you guys to share dis live session. Now we dey see one comment for here, e said please doctor, is there any side effect in one inhale gas smell too much? Cause I work in a gas station and we inhale it every day. Now you know, remember wetin we dey talk about now, we dey talk about tobacco, and dey get different gases. And there are different gases, there are gases to cook and all that, and all of them get their own effect. Yes, remember something, too much of everything na dem dey talk say e bad. So I go advise for those of you wey dey work for gas station or where you dey inhale a lot of gas, I know so most of the time dem dey give una mask, face mask. So dis face mask na to help to reduce the number of things you inhale into your system. No be anyhow face mask, no be the normal, no. They have this N95 and so many they have this industrial face mask that you can wear to prevent you from a lot of gases that is inhaled. It is very good that you dey wear that face mask. That will help to prevent a lot of the substance wey suppose enter your body. And if this substance, remember, as e dey enter small small, in the long run there might be problem, but if you fit control am, e may not cause problem in the long run. Now make we go back. We say for those wey dey smoke and they are willing to stop, so wetin be the things wey dem fit do? We go just mention some wey you go fit do. The first thing I dey always tell pipu, when you wan stop something, if you don made up your mind say you wan stop something, na determination. You need to determine say yes, I wan stop. Now stopping smoking e no easy at all, e no easy. But when you determine to stop it, because pipu don stop, pipu dey smoke before and dem stop. So if pipu dey wey dey smoke before and dem stop, e mean say you too go fit smoke and you go fit still stop. E mean say for you wey dey smoke, you fit still stop if there are pipu wey fit stop. So but na determination na e need. You need to determine that yes, I want to stop. You need to determine am say yes, I want to stop. So when you don get that determination, then you need help. You need help. Most of the time you no go fit do am alone. You need help. You need rehabilitation. You need pipu to help you. And two, as we said, not be wetin you go just stop once. But if you stop am once, e fit still get e own problem wey e go cause. E fit come make you dey irritated, agitated, make you dey angry, fit dey make you dey shake. E fit even make some persons go unconscious if you stop am once. So wetin we dey advise is dat gradual process. For those of you wey dey take 20 once, one full carton once, you go reduce am. You fit come dey take am like doctor prescription, morning, 2 in the morning, 2 afternoon, 2 evening. Gradually you go dey reduce am, you go dey reduce am, you go dey reduce am. And before you know, you go notice say you dey take 1 a day. Before you know, 1 in 3 days. Before you know, the thing go just be like dat. You go just stop like dat. Remember I said e no dey easy, but you need to determine and you need to dey take am gradually. If you just dey join us today, dis one na Ask the Doctor, and we dey always dey do am every Sunday, 8 p.m. to 9 p.m. And today's topic na tobacco. Quit now and breathe better. So if you quit now, you can still have a good life to live. However, for those wey don smoke, sometimes even after dey quit, dey fit still get problem in future. Those one na the problem of you wey you don first smoke. But who am I to say e must affect everybody? No, e may not affect everybody. So na e fit affect some persons, e fit not affect some persons. So another thing is that you need to change environment. If e be say you dey always dey around people wey dey smoke, you need to stop to dey around them. So when you stop to dey around them, then you no go dey get the reason to always wan smoke. So for some people wey go enter rehabilitation, and you also need to speak with a psychologist. You need to speak with a psychologist or a psychiatrist. Now, psychiatrist no mean say you understand say you don lose am o. No. Sometimes you need to talk with these people so that they go help you. They go tell you other steps wey you need to take. And another thing is that for some people, you need to come change wetin you dey smoke. You need to change am. For those wey dey smoke the cigarette, sometimes you fit come change to another thing. You fit come change to the chewing gum. E get one gum wey dey call nicotine gum. You fit come dey chew only that. And with time, you fit even come stop to dey chew that. So we also get wetin dey call the electric cigarette. For some persons, you fit even come from when they smoke normal, you fit change to the electric cigarette. And from there, most people don from there stop as well. But studies don still show say for those wey start with that electric cigarette, dem no dey fit stop if dem wan stop immediately. Dem no dey fit quick stop because that one na process of stopping before, but now that one na dem take start. Okay, somebody dey ask me where Dr. Fred dey. Yes, Dr. Fred just dey backstage and e get some things wey dey put in place, so Dr. Fred no go fit come upstage today, and before the live session end, we may not hear Dr. Fred voice today. So na only my voice you go hear. Madam Blessing, na only my voice you go hear for today. And don't worry, when Dr. Fred come by next week, he go give us the reason why he was on backstage, why he not fit come front stage, come follow us talk. Yeah. So as we dey talk, e go make sense say for those wey dey smoke, make you plan and make you make effort to stop smoking. So that if you stop tobacco, you go fit breathe well. If you stop tobacco, you go save some money when you go take do better thing. You go save some money when you go take chop food. Because if you eat food, good food, your immune system go increase. And when your immune system increase, e go help you fight other infections wey dey around you. And also when you stop, most of all those organs wey be don dey spoil, and because you dey eat well and you don dey try build your immune system, most of all those organs, the bad things wey this smoking would have caused, e go stop. And some of them fit go back to normal. So that's why it dey good for those wey dey smoke before or those wey still dey smoke. So please stop smoking so that you go fit breathe, you go fit breathe better. That's why you go fit breathe better. So if you get any question, put am for the comment section so that we go take your question. We go try to answer the ones wey we fit answer. The one wey we no get wey we no get answer for it, we go still let you know, and we still wan tell you to speak with your doctor. Remember I said for those wey dey smoke and you wan stop, you need to seek for help. And the people wey go fit help you na psychologists, psychiatrists, and those are people wey go fit help you so that because you need rehabilitation. E no dey easy to stop, but there are steps you can take to stop smoking. And not say because I wan just stop now gbua. I talk am, if you stop immediately, e go cause a lot of problem. E go fit still cause a lot of problem. And one of the problem wey e go fit cause, e fit cause agitation, e fit cause irritation, e fit make you come dey very angry, dey aggressive. E fit even come lead to unconsciousness, and some person fit unlife from that part. So to avoid those things, na gradual process na dem take dey stop am. You remember say all these things dey be like dem be drug, but hard drug. So you no dey stop am once because the body don dey used to am. You need to take am jeje so that the body go come dey remove am from the system. So before we go end this live, I go just wan do a little recap on all wetin we don talk today, but I will still dey expect our questions. Make we drop question. Now before I do recap, let's take a little break. Now on our break, we go Dr. Fred get a free video on for those wey wan dey do con ten t creation, wey wan dey create con ten t online. Dr. Fred get a package video teaching on how you fit dey create con ten t. If you really need that, you just check a bio. There are some link there wey you go fit click, and e go lead you to where you go fit get that thing, the videos, the teachings, so that you go fit learn, make you no spoil your page. Also, okay, you go just send email to that email wey dey screen now. So if you need the course, you go send email to Dr. Fred email, and that is doctorfredostar@gmail.com. So when you send email to that person, to that mail, and they go follow up and let you know the other things to do. You go pay small money as you for that. So not the course content, not be free. But if you get the course content, you go know say money when you pay na chikele money. Another thing make I want tell you is that try dey follow us. Follow Dr. Fred, follow me as well. Make you learn many things. There are so many things on our page which you can learn from it. And another thing is, if you never share this live session, wetin you dey wait for? Why you never share am? You just wan talk, you just wan make we talk, make only you just learn. What about people wey dey around you, wey never know anything concerning all wetin we dey talk? Why not share with them? Make dem for still lis ten, and make dem for still learn wetin you don learn. Because we know say many people, many things dey internet, but na very few people na dey go learn the correct things. And it's also good say when you get correct information, share am with your people so that make them too still learn the correct thing. So make we do a little recap because our time don dey go. Dey wait for questions, and I no dey see any question for the comment section. I no dey see any question from the comment section. But before I finish the little recap, if there's any question, I go take am. So little recap on tobacco, quit now and breathe well. So we start by saying tobacco, these are substance when people dey take. When people dey take, and people can take it in different form. I know say there are so many people wey don smoke before, wey don stop. I know say there are so many people wey still dey smoke up till now. I know some people wey dey even think of starting to smoke, So for those of you wey dey think of starting to smoke, or when one thing or the other wan lead you to come think say na to smoke, now e good for you to know say smoking no dey stop problem. You say, oh, I dey use am dey comot problem for my head. E no dey stop problem, because after you don smoke am finish, the problem still dey there, dey wait for you. So no let problem around you go push you to start to dey take something wey go endanger your life, wey go cause problem to every organ of your body. So tobacco can affect us negatively, and e can cause problem to every organs for our body, from our head, from the organ from wey dey the head go reach the toe. Tobacco can affect them. And apart from we human, e can affect our economy, e can affect our finances, e even can affect our relationship with other people around us. E fit even cause problem for home, fit cause problem for home. If taking tobacco dey very very good, why be say when people wan start to dey smoke, dem dey hide dey start? No be good thing. If na good thing, shey you just start am make everybody know. So you dey hide until later you come show am. Why you first dey hide if na really good thing to smoke? Now remember say in many adverts, dem dey do advert for smoking o, for tobacco. Yes, e dey legalized for country, but it doesn't mean say e dey good. Na make even for their advert, by the end, dem come tell you say smoking is liable to on life young. Dat one na to tell you say yes o, e dey, people can smoke o, but no tell me, no say you no hear wetin e fit cause you. E fit affect the brain, e fit cause people to dey get wetin we dey call anxiety disorder. E fit cause stroke for people. E fit affect the eyes, cause cataract. E fit affect the mouth, make the mouth dark, cause coloration for the teeth, even to the tongue. E fit cause mouth cancer, cause throat cancer. E fit cause cancer. E fit cause cancer of the pancreas. For women, e fit cause cancer of the cervix. E dey affect the lungs, go cause cancer of the lungs. E go affect the breathing of person. E go fit cause wetin we dey call COPD. E fit still cause tuberculosis. That is, when we say cause tuberculosis, no be say na im go cause tuberculosis o. E go make person fit quick get tuberculosis. In fact, e go worsen the symptoms of tuberculosis. Even for those wey get asthma, e go even worsen the symptoms. Now for passive smokers, e go worsen their symptom of asthma as well. For the skin, e go fit cause skin wrinkle, come dey make the person skin dey squeeze, come dey make the person dey look like say e don turn old man. The fingers, e go fit put e fit cause coloration for the finger, the coloration like yellow brown color for all their finger. So when you put your hand down, people just see the finger, you just know say this person e dey collect, e dey take tobacco well well. E fit cause problem to the bone. We come call osteoporosis. You make the bones dey weaken. E go fit cause problem to the kidney. E can affect the heart, cause heart failure. E fit cause stroke, fit cause heart attack. Now for women, e fit cause dem make if dem get belle, make dem dey quick get miscarriage. E fit cause when you come even get belle, the pikin go come dey small. There is intrauterine growth restriction. The pikin go come dey small. E fit cause stillbirth. Another thing, e fit cause infertility. E go make man and woman no fit make woman no fit get belle. E fit make man no fit give woman belle, and woman sef no fit even carry belle. Infertility, primary or secondary infertility. And for man, e go make your John Thomas no fit stand well. And some people go say, when I smoke na that time dey feel knack. Remember, all these things wey we dey talk na gradual process. E fit no start at the beginning, but with time, most persons go come get this problem. So e go make sense make we understand these things and make we know them. So if you also wan stop, you go to seek help. You go to seek help. Talk to a psychologist or a psychiatrist. They go put you on a plan on how you go fit take stop to take tobacco. Remember I say tobacco contain a lot of chemicals, and some of the chemicals include nicotine, carbon monoxide. I mention these three because they are so dangerous. Others are very dangerous o, and these chemicals are part of the things wey fit cause cancer and different kind of cancers. Our time is fast spent and we go soon end this live session. We just get like 3 minutes to go. So I never still see any question. And so as far there is no question, we need to end this live session. But before we end the live session, I just want to say a very big thank you to all, to you when they follow us, to you when they burn your data every Sunday from 8 p.m. to 9 p.m. They listen to us. Now, also, everything when we dey talk, sometimes I go say advice say after we don talk, after you don lis ten, e go good for you to verify our information. So I mean you know say we no just dey carry dey talk. Remember say we no know am all. And also remember say some information dey change with time. As time goes on, some information dey change. But we don't take your presence for granted. Thank you so much for always being with us, for always listening to us. We go dey here again next Sunday from 8 p.m. Ask the doctor. Today's discussion was tobacco, quit now, and breathe better. Next week, Dr. Fred go dey with me, and you go grace his presence. He go tell us the reason why he not join us today. I will believe say na good news. Yeah. Thank you for always being with us. Know this and know peace. But as Dr. Fred always talk, good life na wetin na sense. Bye bye.